If you want to be a professional nurse, it is necessary to choose a good school of nursing, because only in a good nursing school can you get the preparation on which your future as a nurse must depend. You first should be a high school graduate, and although the requirements of individual nursing schools vary, in general, it is well to take the college preparatory program offered by the high school. In nursing, as in every other field, nursing school first will be concerned for your own health. You'll be given a thorough medical examination and must meet certain health standards before you are accepted. You will learn to practice rules of positive health, and there should be recreational facilities available for your use and that of your fellow students. Your own personality is very important to the success of your nursing career. The ability to get along with other people is valuable in any profession, but it is absolutely essential to the nurse. You should be strong, because as a nurse, people will depend on you. You should be trustworthy, because people will confide in you. You should be...
She runs a research lab.
They were missing...
But what's that right?
She teaches at a university.
They're not plated down on people.
And she's co-founder of a nanotechnologies company.
So we're looking for is feedback from you.
Living by the wisdom of Yoda, biomedical engineer Michelle Kine is all about embracing life.
The problems that we work on, these are important problems. There is a possibility that we can really make a huge impact on people's lives. That's a great motivator.
Biomedical engineers like Michelle combine biology, medicine, and engineering to design and develop new equipment and methods that improve the quality of human health and life. They design everything from surgical devices, prosthetics, and artificial organs, to systems for medical imaging, patient monitoring, and diagnosing disease. They also develop new medical procedures and research solutions to clinical problems.
One of the key players on any sports team never takes the field. Athletic trainers work in the background to keep players in top shape. The most important part of the athletic trainer's job is helping athletes prevent and recover from sports injuries. Working closely with team doctors, trainers wrap injuries and supervise physical therapy. Trainers spend a lot of time in gyms and locker rooms, as well as on the road traveling to sporting events. They study practice sessions and provide individualized exercise routines for athletes to improve their performance.
Audiologists test patients' hearing and examine patients who have balance or other ear problems. Most audiologists fit patients with hearing aids and monitor their hearing over time. Because hearing loss can influence a person's well-being, audiologists evaluate psychological health and determine a patient's coping skills before they recommend treatment. They treat balance disorders with special exercises, clear earwax from ear canals, and may fit patients with cochlear implants for some types of deafness. They may also do research or educate people on how to prevent or cope with hearing loss.
When a doctor orders a series of tests on a patient, it's the job of medical and clinical laboratory technologists and technicians to prepare and perform those tests to help detect diseases or abnormalities. These professionals analyze body fluids, tissue, and cells. Using powerful medical equipment, they look for bacteria, parasites, and abnormal cells. They also analyze cholesterol levels and cross-match blood samples for transfusions, documenting their results in reports or patient medical records. Since they regularly handle samples and medical instruments contaminated by infectious microbes, they wear protective goggles, gloves, and masks to minimize the risk of contagion.
Open wide! Dentists diagnose and treat problems that occur in teeth in the tissues of the mouth. Dentists use a variety of tools and equipment to fill cavities, repair broken teeth, and remove diseased teeth. To keep teeth healthy and strong, dentists remove plaque and conduct checkups after a hygienist cleans a patient's teeth. They may also make models for dentures. Dentists advise patients on dental care and encourage them to keep up with flossing and brushing. Dentists suit up in surgical masks, gloves, and safety glasses to protect themselves from infectious diseases. When they're not working with patients, they supervise dental hygienists, assistants, and lab technicians and manage business aspects of their practice.
The positive health and lifestyle effects of a healthy diet are very much in the news.
And how long ago did you lose the weight?
The people behind the headlines are dietitians and nutritionists who work to help all kinds of people take better care of themselves by making wiser food choices. For someone being treated for high blood pressure, a consulting dietitian or nutritionist in private practice or associated with a clinic can help design a diet that tastes great with less salt and fat.
Ambulance sirens are a daily sound backdrop to city life. TV dramas and real-life news programs alike feature high-speed trips to rescue victims and speed them to life-saving medical care. Inside the ambulance, the on-site care providers are emergency medical technicians, known as EMTs, and paramedics. These professionals respond to 911 emergency calls, evaluate a patient's needs, and perform needed medical services, such as administering CPR, stabilizing a trauma victim, or dressing a wound. Some paramedics serve on rescue crews based on helicopters or airplanes. Most paramedics and EMTs work for ambulance services, local government, and hospitals. Their work requires frequent kneeling, bending, and lifting to care for and move patients.
Hi, I'm Dr. Christine Blanche. I'm an integrative medicine physician. I have a practice in Great Neck as well as Manhattan. I took the long and windy way through medicine. I started off in emergency medicine, surgery, critical care, and I loved procedures and I loved emergencies. I learned how to fix people, right? If you were broken, if you needed stitches, I knew what to do. And it really wasn't until my sister-in-law got sick. She was diagnosed with cancer, and I knew we needed more than conventional medicine. So I started doing my research, and I looked at all these studies and read all these books, and what I found was that there was a lot that I didn't know about holistic medicine. I didn't know about nutrition. I didn't know about stress. I didn't know about supplements. And when I started to learn all of this, I got incredibly excited. And I went back to school, and I started learning more about integrative medicine. I did a master's in integrative medicine. I went back to medical school. I went and got my PhD and did my PhD in breast cancer research and breast cancer prevention. And for me, this is the best kind of healing that there is, because I get to partner with my patients and I get to really listen to what they need and help them find the tools to focus on health instead of illness. And it's the best kind of medicine there is.
Every time nurses or physicians treat their patients, they need to record what they have seen and done, from x-rays and examination notes to forming diagnoses and treatment plans. Medical records technicians organize and maintain these medical documents. These technicians do not provide patient care. Instead, they work behind the scenes with care providers to fill in missing information, process forms, and ensure that insurance companies receive correct records. They use coding systems to document patient information for billing and record keeping and are responsible for the privacy of patient files. These technicians work at a computer for prolonged periods. Whether they're updating clinic records or tracking a patient's outcomes, accuracy is essential, so medical records technicians must pay strict attention to detail.
When patients arrive for a medical appointment, it's the medical assistant who has prepared the treatment room and made sure equipment is ready for the doctor. With both patient care and administrative responsibilities, they help keep medical establishments running smoothly. Medical assistants often perform several tasks during an appointment. They may measure vital signs before the doctor arrives, assist with the examination, and enter patient information into medical records. Sometimes they may give patients medications. At the end of the appointment, they dispose of contaminated supplies or sterilize instruments for future use. In smaller practices, they may also schedule appointments and prepare samples for lab work, whereas many large practices encourage specialization in either administrative or clinical work. Medical assistants work in doctors' offices, hospitals, and clinics.
Being self-sufficient in everyday life contributes to a person's confidence and self-esteem. Occupational therapists, also called OTs, help people develop, recover, and improve their self-sufficiency and the ability to enjoy work and daily activities more fully. Patients typically seek out the help of OTs due to disability, illness, injury, or mental health issues. They help patients with daily life activities such as feeding themselves, getting ready for work without assistance, using public transportation, and participating in school. OTs work with their patients to identify goals for treatment, then create treatment plans to reach them. Occupational therapists evaluate patients' homes and workplaces to find ways to better prepare the environment for their needs. For example, labeling cabinets or removing fall hazards. They often educate a patient's family and employer about how to accommodate the person's needs.
People recovering from accidents or disease, or who just want to stay active as they age, call on the skills of a physical therapist to help them manage their pain, grow stronger, and become more mobile. Physical therapists, also called PTs, work with people of all ages who have pain or limitations from a variety of sources, including injuries, amputations, strokes, or illness. PTs design an individualized plan for each patient using exercises, stretching, massage, and hands-on therapy. They also teach patients to use equipment like canes or prosthetics. PTs always review a patient's medical history before making a plan, then track the patient's progress during the course of treatment.
Interested in a medical career with more advanced training than a registered nurse but less than a doctor? Consider becoming a physician assistant or PA. Under a physician's supervision, PAs examine and diagnose patients' injuries or illnesses, treat and educate patients, and prescribe medicine. A PA does many of the same tasks a doctor does, from setting broken bones to ordering x-rays and blood tests. Physician assistants work in all areas of medicine, including primary care and family medicine, emergency medicine, psychiatry, and surgery, where they assist physicians during procedures. Like other medical professionals, PAs spend significant time reviewing patient records and documenting patients' progress. Most physician assistants work in healthcare clinics and hospitals. Spending many hours each day on their feet to make rounds and examine patients, the work can be physically demanding. Most PAs work full-time and may work nights, holidays, and weekends.
Looking inside the human body without resorting to highly invasive surgery is the work of radiologic technologists and technicians. They perform x-rays, CAT scans, and other imaging examinations to help doctors develop accurate diagnoses. The technician positions the patient to get the clearest possible image results before activating their equipment. Helping patients feel calm and explaining the procedure is part of the job. For certain procedures, they administer non-radioactive materials into a patient's bloodstream. Technicians also monitor the video display of the area being scanned, adjusting controls to improve picture quality. Technologists may also perform imaging examinations, but in addition, they have the skills to evaluate the quality of the image. They are responsible for handling infectious and radioactive materials and ensure that safety measures meet government regulations.
When it comes to health, there's nothing more fundamental than breathing. Respiratory therapists support all aspects of patients' breathing and lung functions. Respiratory therapists work with patients to make sure they are breathing as comfortably as possible and receiving adequate oxygen, whether patients have a chronic lung disease, underdeveloped lungs at birth, or are recovering from trauma such as a heart attack or near drowning. Respiratory therapists monitor and perform tests to assess patients' lung capacity and assist with treatments such as nebulizers, devices that administer medications into the lungs. They also assist with placement of breathing tubes and withdrawing arterial blood to assess patient oxygen levels. Most respiratory therapists work in hospitals. There, much of their time is spent operating mechanical ventilators for patients with breathing tubes. They also work in long-term care facilities. These healthcare professionals generally work full-time and may work evenings, weekends, and serve on call.
Okay. All right. Getting to know the professors. Yes. That has been My most favorite part?
I love the professors and the opportunity to go out into the community for our clinics.
The small university feel, small classrooms. I really like the professors.
How involved they are in research and dedicated to including the research in all of our classes and getting us excited about research, which can be hard to do sometimes. It feels like home. It's
The people.
Yeah. It's just
They-
one big
all
happy
of these
family.
people behind us and all of our professors, everyone on staff.
Most of us take being able to speak for granted. When speech problems arise, we need the professional help of speech-language pathologists.
You ready? Yep.
Sometimes called speech therapists, they diagnose and treat all kinds of speech disorders. For example, stuttering, hearing problems that affect speaking ability, speech difficulty caused by injury or illness, or mental problems that prevent understanding of words and sentences.
So what you have to remember is that there's a breath before everything you're going to say here.
These experts also help those who simply want to improve their speaking skills. For example, by reducing a strong regional or foreign accent. Many speech-language pathologists work in schools, helping children with speaking disorders and counseling teachers and parents.
Polysomnography refers to the study of sleep. Often, people who are suspected of having a sleep disorder will spend the night in a sleep lab under close surveillance. This is where the polysomnographic technologist comes in. These individuals work in sleep labs to monitor patients and record the results. At the start of their shift, the tech will greet the patient and collect a basic medical history. Once the study is ready to begin, the tech will calibrate the equipment and hook the patient up to a series of sensors and wires which transmit data about the patient's brain waves, breathing, and eye and body movements to equipment set up in the tech's observation room. As the patient sleeps, the tech will stay in this observation room to monitor the information and record any special notes. At the end of the night, the tech removes the sensors and answers any questions. Once the patient has left, the tech goes through the collected data and summarizes the results for the sleep physician to analyze.